how long did you have to go to school to get all of your degrees? You said a bachelor's?
The bachelor's in nursing, it took me 4 years.
Okay.
And 2 years for my master's in nursing.
And did you go full time?
Yes.
Did you work or anything, or did you just go to school?
Yes and no. For my bachelor's degree, I went full time, but I didn't work. For my master's degree, the VA sent me to school, so
Okay.
they paid for my education at that particular time.
Okay, excellent. And what is the role of communication in your career here at the VA?
In my particular field, basically what we do is communication. We do telephone triage, and everything has to be communication-wise, interaction between ourselves and the veterans, the patients that call for whatever reason, and for their needs. And basically communication, if it's not clear, we're not doing a good job.
Okay. Do you have a lot of miscommunication within your calls?
Yes, we do. We do, and we try to adjust because we have, in terms of backgrounds, our veterans, they go anywhere from college degrees to GEDs, and you have to modify and adjust and different backgrounds, not just in education, but where they were born, where they were raised. So you have to try to adjust the things you say, how you say things to their responses.
Is there an easy way to realize how you're going to have to adjust when you first get on the phone with them? Are there specific questions you ask?
We always start with their basic communication with their names and what they're calling for. If they have a medical problem, they have a question about a procedure, a medication, and go from there. Usually by the tone, you can tell if there's any anxiety, just a call to check on something that is not presently important, and we go from there.
How long have you been with the VA?
With the VA, 20 years.
20 years?
Yes.
And have you always done telephone triage, or did you do something more in the nursing, like more with patients before?
Yes, for the first 10 years, I worked in a surgical ward.
Okay.
And then came here 10 years ago.
Okay.
When healthcare started.
What's the difference between actually working with patients person to person and working with patients over the phone? Is it a lot harder to communicate with them?
It is. When you're having a direct interaction, you can just, besides the verbal communication, you can watch body language. Here is only verbal communication, and it has to be perfectly clear to understand what they're saying, what they're asking, and for them to understand what you're trying to convey.
Okay. So if I wanted to go into the nursing career, which I think that's something that I'm looking to do now, would you recommend that I got experience more face-to-face to begin with before I move to anything else?
Definitely. Is the hands-on experience is of the utmost importance. And you can't see all our staff, but I think I'm one of the, not just younger ones, but with the least experience. Everybody, most of our staff came with the VA way over 20 years. And they all have direct, hands-on, person-to-person contact with the veterans. It's very important.
Did you work at any hospitals before the VA, or did you mainly just stay with the VA for your nursing career?
While working with the VA, I worked part-time for other non-VA hospitals, and you can see the difference. Not necessarily better or worse, but in completely different settings. They go about their business.
The VA, do they have a lot of different procedures in most places, or are the procedures all similar so you can adapt easily? Like once you're trained in the nursing field?
It's similar, but just the patient population. In our setting, most of our patients are the elderly veterans, and in the civilian sector you see anywhere from very young to very old, which is also you see that here, but not as often.
Since we started, the war and everything, have you had more younger patients?
Yes.
Because I know you have a lot of Vietnam vets.
Yes.
But now that we've had 9/11 and then we've done Operation Iraqi Freedom and everything,
yes,
we've had a lot more younger patients.
freedom, yes. The number of newer veterans, the younger veterans, has increased, and something else that we have noticed, the number of female veterans has also increased.
Oh, really?
Yes, and
Okay.
it's the younger female veterans.
Do they have, do they seem to have a lot more problems communicating, or is it easier to communicate with women because most women are usually more verbal and explain things
Yes,
a lot
it
more?
is
They go
actually
into
easy. It is easy to communicate with females. I mean, they're more open to express what they feel than men, especially if you have been in the military.
Okay. With the Vietnam vets, do you have a harder time with them as opposed to the vets from our current time?
Not necessarily. They all have the same particular problems that are related to their experiences and because of their age, not necessarily because of what they do. Can you hold that?
I'm sorry.
But in terms of their problems, they're basically the same.
Okay. If I wanted to go into nursing, since I'm in the middle of school right now, and would you recommend like a certain nursing field to go into first? Since you did surgical, did you like that
it's always
more
to
than
have
like general?
It's always good to have a wide background. If you wanted to try something specific like ICU or is usually try to stay within that track because once you go further into the profession, if you try to switch to a completely different role, it's not impossible, but it's a little harder because you don't have the background.
Okay. Can you, like, are there certain programs while you're going through school that you can get kind of a little wide range of everything? Like if I wanted to be an OBGYN nurse as opposed to a surgical?
Only if when you're doing advanced nursing. Like for example, when you go for a basic nursing degree, either a community college or a 4-year degree, you cover pediatrics, you cover OBGYN, you can cover med-surg, you cover psychiatry. Once you go into a specific field,
then you're hardcore into that field.
That's right. And if you want to go further your education and become a certified nurse specialist or nurse practitioner, you will pick a field and then you go more into detail.
How important is communication while you're in nursing school and while you're going through, like, for that specific profession?
It's not just while you're in nursing school, because obviously in nursing school you deal with your professors, you deal with your classmates. When you're doing clinicals, you deal with your patients. But when you're a nurse, you're the center. You have the patient, you have the family, you have your coworkers, you have the administration, and you have all the other healthcare providers. And they always look for the nurse that's taking care of Mr. X or Mrs. Y, and they all look for the nurse, and you're going to be that person. So you have to learn to communicate with all those different people, and they all have their own way of doing things or thinking. So you have to adjust the way you address each other in a different way.
Was that difficult for you to learn how to, like, have to walk up and deal with a family and then turn right back around and talk to the doctor that was in charge?
Not really. I also have a military background, and in which you do basically the same thing. You deal with people from all kinds of backgrounds, all kinds of education, and you learn very quickly to adjust.
Do you think the military helped you
I
a lot?
think it did.